Good morning, everyone. I am Aaleha Izza Baliwan from the SN1A, and today I am going to do a return demonstration for heart and peripheral vascular system. So the first thing that I will do is I will sanitize my hand to prevent the spread of infection. And then I am going to prepare my equipment and make sure that it's all functioning. And then I will identify and explain the procedure to the patient. So, good morning, sir. I am Aaleha Izza Baliwan, and I will be your student nurse for today. So, what's your name, sir? Okay, so how old are you?
15.
Okay, so I just want to inform you that I am going to do an assessment of your heart and peripheral vascular system, and then I'm just so and then now I am and the last is I'm gonna provide privacy to the patient. So I already closed the windows so that to minimize the embarrassment of the patient. So um, the first is inspect the patient for inspect the chest or the anterior chest of the patient. So then position the patient in a supine position. So sir, can you um, and now I am going to uh, palpate the apical impulse of the patient. So now I am going to use my two finger tips to palpate the apical impulse of the patient. So I will ask the patient to exhale and hold it for a while. So, sir, can you exhale and hold it for a while? So, thank you, sir. So, after that, I am going to ask the patient to roll into the other side. And then, sir, can you roll? And then, I'm gonna use the, I am going to use the palmar aspects of my fingers to palpate the apical impulse of the patient. So, sir, okay, so thank you, sir. So now I am going to auscultate. I am going to auscultate the heart sound of the patient. So I am going to use this the diaphragm. First is I am going to use the diaphragm of the stethoscope and then the bell side of the stethoscope. I will use the diaphragm to hear the loud pitch sounds, and then I will use the bell side to hear low pitch sounds of the heart. So I will also listen for the heart sound, which are the S1 and S2. So the S1 is heard as lub, and then the S2 is heard as dub. So I will also listen for murmurs. Murmur is a sound of a sound that caused by a true the turbulent blood flow through the heart. So now I'm going to listen to the So now I am going to use the bell side of the stethoscope. So now I am going to ask the patient to do a different position or in sitting position so that I could listen again and to his heart sound and for some murmur. So sir, can you sit down and then lean forward? Okay, so now the bell side. So now, as I have observed, his heart sound and are all normal, and that I didn't hear any murmurs, and it's all normal. So now I am going to assess the peripheral vascular system. So first is I am going to palpate the client's hands, or I will inspect rather the client's hands. So sir, can I see here? So as you can see, as we observe, his hand colors are all normal. So now I am going to palpate I am going to assess the capillary refill time of the patient. So sir, I just want to also in the and so as we observe as I observe the capillary refill time of the are all normal, because the color of his fingernails are returning for 2 or less than a second. So now I am going to palpate the radial pulse of the patient. So sir, so I am going to use my 2 finger tips to palpate the radial pulse of the patient. So Um, okay, so as I observed, the as I observe and as I palpate, I observe that his radial pulse is um as- bilaterally strong. So that's a normal finding. So now I am going to palpate his ulnar pulse. So, sir. Okay, so thank you, sir. So, um, so as I palpate, I observe that the his his ulnar pulse is not that detectable, but it's all normal because ulnar pulse is not that detectable. So now I am going to palpate his uh, brachial pulse. So, sir. I am gonna use my fingertips to palpate his brachial pulse. So as I palpate, I observe that his brachial pulse are bilaterally strong, and so that it is a normal finding. So now uh, I am going to palpate the epitrochlear lymph nodes of the patient. So now I am going to take the uh, patient's arm, like as if we're handshake, and then I will put my fingertips, or I am gonna use my three fingertips to palpate. Okay, so uh, I observe as I palpate, and I observe that his et epitrochlear lymph nodes are not palpable. So that's okay because that's a normal finding because epi ep, epi epitrochlear lymph nodes are not that palpable. So now I am going to perform the Allen test to the patient. So the first thing that I will do is I am going to use my thumbs to occlude the radial and the ulnar arteries of the patient. So, sir, I am going to use my thumb to occlude the radial and the ulnar arteries of the patient. So I will continue pressure to keep, sir, can you make a fist? So, I will continue pressure to keep both arteries occluded. And, sir, can you release? So, now, I am going to release the pressure on the ulnar artery and watch for color to return to the hand. So now I am going to repeat the procedure to check the radial patency of the patient. So let's repeat it, sir. Can you make a fist? And then can you release? And then, okay, so thank you, sir. So now, the pink coloration in his as I observed that the pink coloration in his arms are normal because it returned for 3 to 5 seconds. If the ulnar and radial artery is patent. So now, I am going to palpate the edema. So I am going to use my thumbs to palpate the edematous area of the leg of the patient. Okay, so as I palpate, I have observed that there is no edema or pitting or non-pitting in the leg of the patient. So now, I am going to palpate the bilaterally for temperature of the feet and the legs of the patient. So I am going to use the back palm of my fingers to feel the temperature of the patient, and then so as I palpate, I observe that the temperature of the foot, the leg, and the toes of the patient are bilaterally warm, and it's all normal. So now, I'm going to palpate the superficial inguinal lymph nodes of the patient. So sir, I am going to touch you. So I am going to use my 2 finger tips to palpate the inguinal lymph nodes of the patient. So now, I am going to palpate the femoral impulse of the patient. So now, So now I am going to ask the patient to. So now I'm going to palpate it. And again, I will also auscultate the femoral pulse of the patient. So again, as I palpate and auscultate the femoral pulse of the patient, I didn't hear any sound in the in his femoral pulse. So now I am going to palpate the popliteal pulse of the patient. So and so sir, can I ask you to So I'm gonna put my 3 fingernails here, and then I'm gonna press deep, and I'm gonna press deep. And then do it in the other side. So as I palpate the popliteal pulse, I observe that his popliteal pulse is difficult or is impossible to detect, but that is just a normal finding. So now I am going to palpate the dorsalis pedis pulses of the patient. So I am going to use my thumb, and then and I will apply it to the I will apply light pressure lateral to and alongside the extensor tendon of the big toe. The pulses of both feet may be assessed at the same time to aid in making comparison. So, as I palpate, I observe that his dorsalis pedis pulses are bilaterally strong, and that is a normal finding. So now I am going to palpate the posterior tibial pulses. So I am going to palpate behind and just below the medial malleolus. We can palpate both sides so that we can compare it. And as I palpate and observe, the posterior tibial pulses are posterior tibial pulses are bilaterally strong, so that's a normal finding. So now I am going to assess the neck vessel of the patient. So now I am going to use a ruler, and I am gonna stand at the right side of the patient, and then after that, I am going to auscultate the carotid artery of the client. I will auscultate the carotid arteries if the client is middle-aged or older, or if you suspect cardiovascular disease. So now I am going to place the bell. I am going to place the bell side of the stethoscope into the carotid artery, and then I will ask the client to hold his or her breath for a moment, so that breath sounds do not conceal any vascular sounds. So, after auscultating, now I am going to palpate the carotid artery of the patient. So, I am going to use my two fingertips to palpate the carotid artery of the patient. So, as I palpate and observe, his arteries are elastic and no thrills are noted, which are all normal findings. So sir, so the results of your assessment of your heart and peripheral vascular system are all normal. So if you ever feel anything or any abnormalities in your body, then you can come back, and then we can do another assessment of your heart and peripheral vascular system. So sir, I just want to thank you for cooperating, and thank you sir, and that would be all for my return demonstration for heart and peripheral vascular system. Thank you.